Let's give them a nice big hand for going first. How nerve-wracking was that? And you did a really nice job. Very nice first sort of example of a good role play. So thank you guys. Thank you for having lots of courage and trying to follow along. Okay, so today what we're focusing, and I should have reiterated this, but it's you guys had it down. We're focusing today on open versus closed-ended questioning and attending behaviors. Okay, so observers, what did you see, the two main observers?
Yeah. Rafa did a really good job with the verbal tracking. Like when they were talking, he did a really good job at listening to what they said and kind of like restating it to them in a different way.
Okay, so that would be more paraphrasing than verbal following. So remember the verbal tracking is kind of taking the last few words somebody says and either restating it or asking it as a question. So just so that you guys are clear on those two different skills. So paraphrase, we haven't even covered that yet. He's doing it, which is awesome. So paraphrase is sort of just a restatement of what somebody has said, whereas verbal following is just taking the last few words. Okay.
I thought your guys' nonverbals were really good because your eye contact was always on them, like consistently, and then you're also like attentive to them, and it seemed like you really did care, and like by leaning forward, and like you could really tell you were engaged.
Yeah, I saw a lot of leaning forward, particularly with Juliana, and Rafa, I noticed a lot, not too much, but a lot of good nodding and sort of minimal encouragers in that way. Anything else from our observers?
I thought you did a good job of also like asking for specifics and examples, because it got them to talk more like open questions.
Okay, good. Okay, yeah, I would agree. I think Rafa, you did a nice job starting. It's kind of a hard thing to start. You're not quite sure what to say. And Juliana, you did it. You kind of kept it nice and tight. You said, "What brings you in today?" Which is a nice way to start. You don't have to do a real long introduction. Of course, when you're first starting with your clients, technically you're going to do confidentiality. You're going to talk about informed consent. You're going to talk about how you kind of run things in the agency. We don't have time to do that here. So it's okay to just start with what brings you in today, which is a nice beginning. And then I like Rafa's questions about, it was an open question about, would you elaborate on that? It's a very good question. Try to keep your questions concise and stay away from qualifiers. I do this all the time. Well, do you think it might be possible for you to tell me a little bit about, those are all kind of possible, a little bit about. Tell me more, and leave it at that, okay? Or could you tell me more about that? But you used a few too many qualifiers. I think you said, would you like to possibly elaborate on that? Just cut out those qualifier nervous words that we all use. I don't expect you to do that in the first few weeks. That's something that we're going to be working on over time, but I just want you to be aware of them so that you notice when I'm using too many qualifiers, okay? Juliana, nice paraphrase. Juliana, you asked two very good questions, but you asked them right after the other. You said, what exactly is she doing to do whatever it was? And then you said, can you give us an example? Just ask, what exactly is she doing? Stop there. So ask a question and stop, okay? Let's see. Rafa, good question about what does it mean to be perfectly raised. You had good nodding. Try not to laugh. Observers, you're making it difficult for the counselors to stay in role, so try not to laugh even if the client does something funny. Try not to laugh because it's going to make the nervous counselors want to laugh. So try to stay in your role, because you wouldn't laugh in that situation because you're going to piss mom off. When she says something smart, right, and then you laugh, that's going to piss mom off. So you want to try to stay in role, try to stay professional as best you can. Observers. All right, let's see. Try to mirror the facial expressions a little bit more. Both of your body language was very good. You were leaning in and you were just kind of relaxed with your hands in your lap. It was very nice. I didn't get the sense of stiffness between either one of you, but your face was kind of like, okay? So try to mirror, try to raise your eyebrows, and when you squint your eyes and you're listening, and yeah, that must be hard. You're communicating with your face. Thank you. Communicating with your face. No, I appreciate it. I know that, blah, blah, blah. You're communicating with your face just as much as you are with your words, and sometimes that can even elicit more from the client. So So remember to use your face. Rafa, I like that you set limits about interruptions. That was very nice. And I don't know if you all noticed what happened, but Terry thought that she couldn't, that she was kind of whispering to them. As an observer, you guys have you can use your voice. I want you to be the therapist too. So if you see kind of us getting stuck here, go ahead and use your voice to intervene. And that was a very nice intervention. You said that was a nice open question about the explanation. Okay. Two people had their hands up. Let's quickly go to. You had your hand up?
Was answered.
Oh, it was.
Yeah.
What was the question?
It was if we have to explain the rules before.
No, you don't. Okay. And Monica, did you have your hand up? Somebody else had their hand up. No? Maybe it was just Cyril saying, okay, time to be quiet. Okay, so let's close that and let's